Perfect. Thanks so much, Dr. Clemens. And again, thank you to the Miami group, Michelle in Setting Scoliosis Straight, and especially the patients and their families, because every time I attend one of these, I learn so much from you guys, and hopefully it keeps making me a better and better doctor. So I'm really happy to be able to talk about postoperative functional expectations, because I think that's one of the main conversations that I have with families, and one of the first fears that patients are at least willing to address. So goals, we've all been through these: halt the progression, correct the deformity. All of us are focusing on maintaining these motion segments, because one of our main goals is to get you back to doing everything that you were doing before. And so, like I said, this is one of the biggest fears that kids come in with, that they're super active, and after surgery, they're going to have a big, ugly scar on their back, and that they're going to be stiff and walking like Frankenstein. So that's one of the main things that I want to address in this talk, that that's not what's going to happen. So sports participation in physical activity has been shown to be very, very important, not only for its physical benefits in terms of weight loss and cardiovascular benefits, but the values imparted by organized sports. All the parents here know exactly what I'm talking about, and it's actually been presented with research also. I have a 7-year-old little kiddo who's into Taekwondo, and I've seen her confidence just blossom with this activity. And then even team sports like soccer, basketball, it really, really helps your kids to be involved in these activities. So what is return to play or return to sport? So in spine surgery, this hasn't really been a focus of ours. We're always very proud of our straight x-rays and that we've minimized complications and that we've made it through the surgery. But our colleagues in sports medicine are very focused on getting kids back to doing what they were doing. So in the adult world, we worry about getting you back to work. In the pediatric world, we really should be focused on getting kids back to their sports. So like the first point shows, there's no scientifically validated factors in scoliosis to say that, yes, you are safe to go back to work. So what are the factors we look at? We see how bad the spinal deformity was, what levels we decided to fuse, what kind of instrumentation we used, and then the types of sports and activities that your kid's going to be involved in. So in my mind, I break it up into 3 categories: non-contact sports, that's shown there; contact sports like soccer, basketball, volleyball; and then collision sports, wrestling, football, and hockey. And then the factors influencing post-op function. So there's patient-related factors. You're going to lose some flexibility in the spine. There's going to be some issues with regaining your balance because your spine has been growing curved for a number of years, and now you're going to be in a straighter position. Physical deconditioning, and then that fear of re-injury. And then from our perspective, we're worried about that fusion taking place. So like we all mentioned, one of our main goals is to get the spine straight, but keep it straight. And that fusion takes somewhere about a year. So during that time, you really need to be careful about the activities that your kids are doing. And if there's always a balance between how long it takes the spine to get fused and then the implants failing. So we want to make sure to minimize the activity and motion to allow that fusion to take place. And then for the long-term stuff, we worry about adjacent segment degeneration. So if the top part of your spine is fused, we worry about what's going to happen in the bottom part as you get older. So what do we recommend? I think Dr. George talked about these studies previously. Since we don't have any good data or evidence-based medicine to tell us what to recommend, we just ask our peers, hey guys, what do you recommend? And then maybe we can come to some kind of consensus. So that study was done back in 2002, and you can see there really wasn't much consensus. Just a little less than half of the surgeons recommended low-impact, non-contact sports at 6 months. A little over half recommended contact sports at a year, and about half felt that level of last instrumented vertebra, the LIV, played an important role. And then the study was repeated again in 2015, and I feel like we got a little bit more consensus. So most surgeons don't do any formal post-op physical therapy, which I think that might be changing now over the next couple of years. By about 3 months, we allow patients to run. By 6 months, we allow non-contact and contact sports. And then at a year, we allow collision sports. And in that study group, so it was about 13 surgeons or so, there was only 1 incident of a spine fracture after a snowboarder returned at 2 weeks post-op. But besides that, almost 900 patients that were included didn't have any issues with the implants failing or the fusion not taking place. So that's what we recommend, but what do patients actually do? So this study came out in 2002 saying that kids are back to activity a lot faster than we recommend, which is actually fantastic. It's good to see. So 93% were back to non-contact sports by 4 months and 96% to contact sports by 8 months. This study is from Ireland, and just to show you that, patients are going to be different in different parts of the world, these kiddos are back to school by 10 weeks and to unrestricted physical activity by a year. So that's a little bit slower than what we see in our populations here in the US. And then activity after scoliosis surgery. So now you can see we're starting to get interested in studying what kids are doing after surgery. So mean time to return to play was about 7 months. So about half the population was back by seven months. And at 5.5 years out, about 60% of patients were back to the same level or higher of participation. And for those kids that didn't get back, why was that? It's because they lost some flexibility in the spine, they were having some back pain, some deconditioning, and then that distal fusion level, that seems to be a recurrent issue. How long of the spine did you actually end up fusing? So that was the point that we were trying to make in that surgeon panel earlier. If we can get to the spine and just fuse the top portion, there's some benefits to that, and these studies have kind of proven that out. So flexibility based on lowest instrumented vertebra. This study with following kiddos 10 years out from surgery, broken them up into 3 levels depending on how low the fusion went. And group 3, or the fusion that went lowest into the very bottom part of the lumbar spine, definitely had less mobility, worse SRS scores, which is kind of subjective, how the kids think they're doing, and more pain. And then this study done by Michelle, actually, from our group, showed that if the fusion went longer, there was a lot more motion in the few segments that were left, indicating that maybe that might cause issues in the long term, 20, 30 years down the road, that those segments start to wear out. So what does the future hold? That's really the mecca. This is what I wish I had data to be able to tell my patients. What are their kids going to be like 40, 50 years down the road? And this study, which is just at 11 years post-op, compared kids who had the fusion versus age and gender matched controls who didn't have scoliosis or surgery. And you can see there was no difference in function, pain, or disability, but all these kiddos had an MRI, and there was slightly increased rates of degenerative disc disease and facet degeneration in the kids who had scoliosis surgery. So we're definitely changing the spine. When you fuse the top portion, you're doing something to the bottom. At 12 years, it doesn't seem to make a difference, but what I really want to know is what's going to happen 30, 40 years down the road. So many, many unanswered questions. We really appreciate all the support from patients and their families to let us keep studying these kiddos, and hopefully we can come up with more answers down the road. Thank you.